Thrive with Dr. Varsha. In today's video, we will see how a fifth year PharmD curriculum looks like. We will break down subjects and chapter. What is the scope of that subject? How that subject will help you in career, whatever career you will decide. So how that subject will help you in that, or those subject, how that subject will let you know that which career it is promoting or it is supporting. We will see what you can expect in exam, what will be the weightage of each topic, as well as we will see few tips how you can thrive in your fifth year. Now this is what your curriculum looks like according to PCI. Now your first subject is clinical research. Only theory will be there for all of the three subjects. You'll be having three subjects. For all of them, you'll be having just theory, no practicals. So you'll be having 3 hours of theory lectures per week for this subject. What is the scope of this subject? If you want to pursue career in clinical research, then this subject is so important for you, as well as even if you don't want to pursue career in clinical research, yet these studies, these guidelines, you should be knowing all this. As well as if you want to work in regulatory affairs, then also this subject is very important for you guys. If you want to develop any molecule, any drug, as well as if you want to publish that into the market, then what is the procedure, what is the protocol, what are the guidelines, you will have to follow all that. And you will be studying in this subject, as well as how you can design your study, by what protocol, and after you completed your study, how you will do that study of your molecule into the market. You'll be studying all this in clinical research. This was the brief, but we will see in detail. Drug development process. See, from here only you will be learning how you will develop the drug. See, for the introduction, then various approaches of drug discovery. There are different approaches. So which approach then you will follow? You'll be learning that. Then pharmacological, toxicological study, then IND application. First is pharmacological study, then next is toxicological study. IND application, you will have to apply to conduct this study. What is the first step? Then this is the first step. Then drug characterization. From first chapter, you can expect each and everything for 5 marks, but the IND application with one of the other topics, that is drug characterization or dosage form, or it can be combination of IND to the other topics, you can get that for 10 marks. Rest of the things are for 5 marks, as well as 2 marks. Then the second chapter, that is clinical development of drug. Now you will be actually into developing the drug. You will learn how you can develop drug, how you can conduct a clinical trial, phase 0 to phase 4. Now what is that? You will be learning that. I will teach you about it also. You can look forward. I will making video on that. What are the guidelines you will be following to conduct that clinical research? You will be learning that. That is GCP, ICH, then CDSCO guidelines. Who will be those people who will be making those guidelines? You'll be learning that also. How any committee is formed for your own, for your particular clinical study. That is, if you want to perform or if you want to conduct a clinical research on a particular topic, then for your, the specific committee will be assigned for you. How that committee is made, on basis of what, who are those, what are this qualification, what are those, what are their designation, you'll be learning that. Then introduction to clinical trials, you'll be getting this for hardly 2 marks. Just you will have to explain the classification of phases of clinic, the second chapter, the various phases of clinical chapters, sorry, various phases of clinical trial, from phase 0 to phase 4, and write little bit of those for 2 marks as well. Each and everything you can get for 2 marks, 10 marks and 5 marks from this chapter, but I will specifically tell you that this is for first 2 chapters is for your 5 marks. Third is methods of post marketing surveillance. Once your drug is out in the market, how you will do that study to see the people's reaction, how that drug is reacting into the patient, because there are many drugs which gets entered into the market, but after some amount of duration the drug get bans. Why it get bans? What are the guidelines and protocols for it and the criteria also why the drug is getting banned, as well as there are many drugs which become a huge big hit. So why those drugs become hit, what are the protocols, do they not show any side effect, as what are the certain level of side effect those are considered as okay, and what are those side effect or adverse effect which are considered as right now the drug should be banned. What are those protocols, what are those guidelines, what are those signs you will be learning through this chapter will be for 5 marks again. Then fourth chapter, abbreviated new drug application submission, ANDA application. So again, how that application looks like, what is the importance of that application, for what purpose you are applying into that form, be studying that. So chapter will be for again 5 marks. Then fifth, uh, good clinical practices. Now there are guidelines, multiple guidelines, you can expect all these guidelines for 5 marks as well as 10 marks. And then they can ask you in combining, explain ICH and GCP guideline, or GCP or CDSCO guidelines. CDSCO is a huge chapter, so maybe that can be asked for 10 marks separately. Then sixth is challenges in the implementation of guidelines. What challenges can occur when you are implementing guidelines into that particular study, or on the entire nation regarding that drug, or regarding conducting a clinical trial. So what are the challenges can come, so you'll be studying in this. Again, this can be asked for 2 marks, 5 marks. Then ethical guidelines in clinical research. So what are the ethical committees, you'll be learning that also. Then what are the guidelines in clinical research, you'll be learning that also. Again, this question will be for 2 to 5 marks. 8 is composition, responsibilities and procedure of IRB IC. Now they can ask you little bit of that, that explain the enlist the composition responsibility of IRB or IEC. That will be asked for 2 marks, but if they ask you in detail, then that will be for 5 marks. Then overview of regulatory environment in USA, Europe and India. Now this is a huge chapter for whole India, for a complete Europe and a USA. You will have to learn what are the regulatory environment in those particular countries. So that will be for 10 marks. Then roles and responsibility of clinical trial personnel as per ICH and GCP. Now these are guidelines, and in clinical trial I have explained in my one of the video, that is what are the career options after PharmD. So in that you can see there are multiple career options, and in one of that I have mentioned that you can become a clinical research associate. In clinical research I have mentioned all this, can become all these, that is sponsor, investor, clinical research associate, auditor, then contract research coordinators and regulatory authority also. So what are those, what are these responsibility, and how they perform, and how anyone is called as sponsor or anyone is called as investigator. So you'll be learning about that. It's a very easy chapter, guys. So that will be for each and everyone will be for 5 marks, but always they are asked for in combination, that is mention or explain roles and responsibilities of the clinical trial personals as per ICGCF, and they will give you A sponsor and D and B auditors. So that will be for 10 marks. Chapter is designing of clinical study documents. Now when you are performing any clinical research, so from start till the end you will be having lot of protocols, lot of documents. So what will be there, what are the rules in your clinical research, how it should be designed. So that is protocol, CRF, ICF, PIC with assignment. Then the next chapter is informed consent process. Now if you are including any humans in your clinical research, then you will have to take informed consent. So how that informed consent is designed according and particularly according to your study, so that you will be learning in this. That question will be asked for 5 to 10 marks, as well as the 11th chapter will be asked for 5 marks. Each and everything is for 5 marks, but they can ask you in combination for 10 marks. But you can understand the weightage of each and every chapter, and you can design an answer for your exams accordingly for the 5 marks. Then 13 is data management and its components. Now, how you will manage data, as well as what are the components of each and every data as of one, you'll be learning that. Then safety monitoring in clinical trials. Once you are completed everything, and while you are completing everything and performing daily research, so during that the safety should be maintained. How that safety will be maintained, who will be monitoring into your clinical trial? One will be from our side as well as one will be from the appointed side. So again, all these chapters are for 5 marks. You can design an answer for 5 marks, but in combination they can ask you for 10 marks. But you should get an idea that the weightage of each and every chapter is for 5 marks. According to me, each and every reference book you should refer, but whatever it is available in your library, you can refer that, as well as your professor tell you to refer something, then refer that. Second subject is pharmacoepidemiology and pharmacoeconomics. We'll be having 3 hours of theory lectures per week. Why we will study this subject? Because as the name says, epidemiology, that is people, that is population. You will be studying that population. And pharmacoeconomics regarding that population, pharmacoeconomics regarding the healthcare services. Now, healthcare services are provided by multiple areas. So, what work you will have to do in a layman's language, anyone can understand this now. I want to tell you about this whole subject, why you will study this subject, and what this subject's about. Just a few lines. That is, see, if there is a patient, everyone is a consumer of some and some nutraceuticals or any drug. I will say that not everyone is consumer, but at some extent there are many. So patient receives healthcare services from multiple sites. Collectively, patient receives any healthcare services from one side, but each and every area comes together to provide healthcare service at that point. That is a retail pharmacy or a hospital, but behind that there are multiple healthcare providers which are working for them, and that's why they are connected, and but they are not seen in front of patient, but they are included in that healthcare services providers list. Now, who are those? That can be industry, that can be the people who develop those guidelines, that is a clinical research area, then an industry, as well as a regulatory affair area, those are making those guidelines, and then the retail pharmacies, then hospitals, and etc. These are the healthcare providers. You can get the healthcare service from all these things. To work in this area, you would be called as pharmacoepidemiologist. Now, what is your work? Now, in simple line, as I told you, I will tell you, that is, it is when that patient is receiving any healthcare service from any of them. Now, patient didn't buy any drug from directly from healthcare industry, no, but these are people who are responsible. These are the areas which are responsible for anyone's healthcare journey. Pharmacoepidemiology help you in looking forward regarding patient, how that patient will be benefited from any healthcare services, either it is direct or indirect, how that patient will be benefited, as well as the cost will be less, the medication effect, the benefit to the patient, that is a quick recovery should be there, then the ratio should be high of the recovery benefits, and the cost should be less. So your work will be that. First is pharmacoepidemiology. Definition and scope. Origin and evaluation of pharmacoepidemiology. Need for pharmacoepidemiology, aims and its application. Now you can expect this chapter, that is definition, scope and everything included in that, for 5 to 2 marks. Then measurement of outcomes in pharmacoepidemiology. How you can measure those outcomes, that is, if I am using certain drug, and if you're a pharmacoepidemiologist, how you will measure that, okay, now Dr. Varsha has getting benefit of this much, like this much level, like 80%, will be there will be having an multiple units, how you will measure my benefit, as well as how you will measure the risk and how you will measure the cost. Now in everything into this chapter is regarding cost benefit, health benefit, and risk. How that cost will benefit me, health benefit, as well as risk, what risk can be there after using certain things. Now you can expect this chapter and each and every point into this for 5 marks, and and in combination you can expect that for 10 marks. Chapter is concept of risk in pharmacoepidemiology. Now there are multiple types of risk, how they are classified, you'll be learning in that, and how you can see in a particular patient and which thing you can apply in a particular patient regarding risk. Sometimes the drug is expensive but the benefit is good, and if you are buying some alternative then the benefit will be less, because the cost is also less. In that condition you will have to see that the patient should be the first, aim should be the patient safety, patient health care, patient health should be improved, and then the cost, how that cost will be maintained. And if okay, if I consume any drug, now I got some infection, it's a bacterial or any viral infection, and I'm getting multiple drugs, and alongside I'm getting pantoprazole, but because I'm going to get a side effect, that is I'm because of I'm consuming many drugs, so that's why I'll be having a side effect, or maybe I will generate a side effect of acidity, so for that I'm getting pantoprazole. But if there is some another drug option for my bacterial or any viral infection, that they will not having any side effect of acidity, but it is very expensive, in that condition what we can do, which option we should be selecting, you will be learning that. And once you do a job in this area, you will be deciding on these topics. So we are discussing on a case study scenario. Now I'll tell you, this acidity can be maintained in me, but again the acidity condition, in inflammatory bowel disease or any inflammatory case which is severe, as well as in cancerous patient, we can't take a risk of such acidity condition, then we will go for a expensive option. But over here for me, what we can do, okay, we can if we are getting the side effect, that is acidity, can we maintain that just by taking one tablet? My acidity, my acid levels are normal, I'm not suffering from any acidity, then we can go for that option. So that is my health will be also improved, the side effect which I was getting, that will be also taken care of, as well as the cost of my entire treatment has become less. So we can go for such option, and you will have to decide all these things in this area if you want to pursue career in this area. Then again all this will be for, again the classification, few things about it will be for 2 marks, but rest of the things will be for 5 marks. Next is pharmacoepidemiological methods. Now there are different methods, that is DUR, that is drug utilization review, then case report, cases series. Now there are different types of studies. So you will be learning these studies, and on what basis of a particular, if you want to see which treatment is more beneficial in this particular, um, in this particular area of patients, or this particular criteria of patients, then which type of study you will have to conduct and what that study tells you. And while deciding your pharmacoepidemiology, one of the roles, that is you will, and now only we have discussed that regarding the patient's benefit, so which study you should pick up as a reference to decide something on that. So for that you'll be studying all this. That is, now though there is one thing called a spontaneous reporting, then prescription event monitoring, and record linkage system, the systems you'll be learning. And again this in combination you can get this for 10 marks, but rest of the things is for 5 marks. Then sources of data and for pharmacoepidemiological studies, that is add HOC data sources and automated data systems. Now there are completely different systems into a particular area. You'll be learning all those systems. Selected special application of pharmacoepidemiology. Now what are the as a pharmacoepidemiologist, what are the application of this field into this particular criteria, that is vaccine safety, hospital pharmacoepidemiology. Now in hospital pharmacoepidemiology you will have to see there is a term called as you must have learned hospital acquired infections or community acquired infections, so how you can reduce that, so you will be having role into that. Then pharmacoepidemiology and risk and management, drug induced birth defects, so you'll roll into this. Then the second main criteria is pharmacoeconomics. You'll be learning definition, its history and need of those pharmacoeconomic evaluations into this today's world, into the healthcare. Role in formulary management decisions. Now, once whenever a hospital is established, there is a formulary of a particular hospital. The treatment provided by one of the hospital will it will be differ from the another hospital because they have a particular formulary. That formulary is made on the basis of patient benefit, how patient can get the result of that drug with less side effect, that is less harm, then that is less risk at the less cost. Will be deciding that formulary on that basis. Then pharmacoeconomic evaluation. Now, outcome and assessment and types of evaluation, how you will evaluate each and everything. Then it includes various methods, that is cost minimization, cost benefit, cost effectiveness, and cost utility. Now these are the some methods. From name only you can understand this cost minimization, how we can reduce the cost. There are in what situation we have to reduce the cost. For if you want to make decision regarding a particular drug or particular patient, then cost benefit, that whatever the cost is, how much it should benefit, the equally or higher the benefit should be higher. Then cost effectiveness, how that cost regarding the effectiveness of to the patient, how that is benefiting. In this we will study, and in effectiveness how the effect will be shown regarding the cost. Then the third is application of pharmacoeconomics. Now again you can enlist, they will tell you to enlist all this for 2 marks, but this will be for five marks. You will be learning about software and case studies. Now YouTube you can find that I have made video on SPSS. I will include that in description box below. That is one of the software that is used in pharmacoeconomics. What those software do, what type of study they perform, what type of analysis, how the data has been stored into that software, how that software work. You'll be studying in this, and you will be studying multiple case studies. So you can expect this for 5 marks, as well as they can ask you multiple software at a time, like two software, then you can expect that for 10 marks. Now I don't want to scare you, but this is the tough subject, that is clinical pharmacokinetics and pharmacotherapeutic drug monitoring. We're having 2 hours of theory lectures per week. Now, again, why we will study this subject? A basic term I will tell you about this, that is in a particular scenario of a healthcare, you must have seen there are tablets which are being sold in a particular dosage form, as well as the strength will be like for a particular drug will be for 250 mg, 500 mg, and 650 mg. Nothing is in between. You can't get like, okay, I want to consume two uh, I have to consume 2 doses in a day, so can I get this medicine for 1000 mg? Is it available? No, it's not available. Then you will have to consume it 2 times. By those particular strengths, on what basis those particular strength has been designed for the entire population, on what basis? So there must be something, right, criteria, and all those details you'll be learning into this subject, as well as pharmacotherapeutic drug monitoring. Again, whatever it is sold in whatever strength, it sometimes it is not required for each and every individual to consume that particular strength. What is available in a standard, what is a particular drug strength, as well as the dosage form according to your own body, according to your body. So you will be designing that into this subject. Now it is decided on the basis of the gender, weight, the body fat percentage, muscle percentage, then from which race you belong to, which country, then the again the atmosphere is also responsible for deciding on this, what strength you should be given, what dosage form you should be given, as well as there are many factors. You'll be learning all those factors and you will be able to design a particular drug and in a particular dosage form and in a particular unit strength for an each and every patient in a customized way into this subject. So let's begin. The first chapter is the introduction to clinical pharmacokinetics. Again, this chapter will be for 2 marks to 5 marks. So you'll be getting a rough idea about what you'll be studying in all this, the importance and its application into the work area. Then design of dosage regimens. Now we have seen how you will design a particular dose regimen for each and every patient, that is in pediatrics, elderly, obese patient. Now mm, a particular drug is there, and if someone is underweight or someone is overweight, how the distribution of drug happens in each and every body. Will that drug will be sufficient for a person of 100 kgs and a person who is 40 kgs, a same amount of drug? Are there any differences, or do we need to change? And if we are changing it, to what basis we should change? What are the criteria we should follow? What are the measurement formulas to change that drug into a particular for each and every patient? Then determination of dose and dosing interval. Now if you have seen, if you have consumed any drug in your life, then you will be you must have seen the frequency 101. You have to consume a drug in the morning and at night, before food, after food. On what basis you will be deciding that? So you'll be learning into this. In conversion from IV to oral, of course, in you must have seen the patients in the ward during the ward rounds, that during OT they have consumed a drug, or while they can't consume any drug through the mouth, during that time the drugs were given through IV, and when the patient was stable, then drug is converted into oral format, that is tablet or a syrup. Then how those conversion is made and on what basis and when it has been converted, when, and how you will convert that, the effect should be seen into the patient exactly same way as it desired. Then the next chapter is again the second chapter is for each and everything is for 5 marks, and again in a combination you can be asked this for 10 marks. Then some of the formulas can be asked in from this chapter, that is drug dosing in elderly patient, then determination of dosing intervals and dose. So that can be asked for 2 marks. Then the third is pharmacokinetics of drug interaction. Now again, whatever you have seen in your pharmacology, uh, a different approach to it, as well as whatever you have seen in pharmacology, that will be also there. The pharmacokinetic will happen: inhibition, induction of drug metabolism, inhibition of biliary excretion. Now for this you'll be having a multiple drug, not just they have given inhibition of biliary excretion. Now biliary excretion, for particular drugs they will be giving some of the drugs, so you will have to study this topic for those some of the drugs. Then therapeutic drug monitoring, well, this looks really simple and so easy. In such short para they have included this, but it's a huge, and it's like it will take 70% of the time of an entire year. So yes, this is you can expect from this therapeutic drug monitoring. As I've already told you, a patient specific drug dosage form and its strength will be learning through this chapter. Individualization of drug dosage regimen. See, on the basis of genetics, age, weight, disease, interacting drugs, and again there are many. There, what race do they come from? Caucasians, then Africans, then Southeast Asians. So how they will react, then indications for TDM, protocol for TDM. Now this chapter will be for 2 marks as well as 5 marks. Then pharmacokinetic and pharmacodynamic correlation in drug therapy. Then TDM of the particular drugs in this cardiovascular disease, seizure disorder, psychiatric condition, and organ transplantation. Now in cardiovascular disease, they will be having a particular list of drugs and number of drugs like 10 or 12. You will be having to learn this tedium of all those drugs. Now again that will be asked for 10 marks, means you will be you will be knowing through your professor when they will provide you a certain notes, then you will understand, okay, this will be for 10 marks, this is it, because the length of an particular drug and tedium answer will be will determine for how much marks it will be there, for 5 marks or 10 marks. Again this can be asked for 5 and 10 marks also. Hmm. And you, whenever this chapter is included into your exam, then just just keep in mind you will get majority of questions, the 10 marks question from this chapter. This is for sure, guys. This dosage adjustment in renal and hepatic diseases. Now, there are many conditions in which hepatic and renal impairment occurs, as well as again the specifically renal diseases occur as well as hepatic diseases. So, in that, how you can design a particular dose and how you can adjust a standard dose for that particular patient will be learning into this. All this will be asked for 5 to 10 marks, and for 2 marks they can just tell you to mention the pharmacokinetic consideration, just enlist and write few things about it, but rest of the things can be asked completely for 5 to 10 marks. Then the next is population pharmacokinetics. Now through what theories has been effective in the pharmacokinetic studies and in the therapeutic drug monitoring. So you'll be learning about those studies, what those studies have done, and how the data has been used in a particular way, and how the patient population data has been used in a particular way, so you can get an particular result. You can develop an approach as well as develop a specific dosage regimen or a particular dose for of a particular strength for a particular population of patients. So you'll be learning through these methods. Again this chapter will be for 10 marks, and they can ask you maybe for 5 marks, but mostly it will be for 10 marks of what. And through what I'm saying all this, because from my personal experiences as well as our professor told us this, and the university paper which I have referred from other universities, uh, through that I'm telling you this. The next chapter, that is the next section, we can say pharmacogenetics. Now how a genetics will affect in drug metabolism, in drug transport, how that metabolism will if give an effect in a particular patient differently from other types of patients. So we'll be learning into this. Then pharmacokinetics and pharmacokinetics slash pharmacodynamic consideration in a particular therapy for a particular patient or a particular group of population and for a particular disease condition. You'll be learning that linkage and those consideration in this. Again, you can expect this for 5 to 10 marks, but the first chapter you can expect that for 10 marks. Again the second chapter, that is genetic polymorphism, you can expect that for 5 marks, and the third chapter, those consideration, you can expect for 2, 5 and 10 marks. Now this is the completion of the 3 of the subject. You will not be having practical, as I told you, and after this 3 subject why this year is called as most toughest and most burdensome year, because you'll be having to learn all these subjects which are completely different from each and every subject which you have studied in your previous years, because some and some they are connected, and even if they are not connected, they are relatively easy than the subject included in this year, because this year is like complete application. It's like they are making you job ready. These subjects are very tough to study, but yet again it requires daily repetition to learn all those subject and all those concepts, because they are actually followed in a daily life if you are going to do a particular job role. That's why they look so hard. And again, those job, if you select, if you want to work in a particular area for those subject, then they are tough. So this is a very tough year, because you will have to do thesis, you will have to learn all those completely different subjects, then you will have to do all this hospital work alongside with anything extracurricular is there from your hospital or your college. So all this will be there into this year. So this year is going to be tough, but you will have to do it. And again, I believe that you can do it, because if I do it, then I guess everyone can do it. I will make videos on all those chapters one by one, or like I will explain and teach you each and every concept. So stay tuned for that. And if you find this video insightful, please like, share, and subscribe. Thank you. Bye bye.